Hi everyone, welcome to researchmd.com. We got a great presentation today. We're going to teach you all about a very, very important deadly topic, serotonin syndrome. And we're going to do that under 9 minutes. And all of our reviews from now on is going to be under 9 minutes, so you can save a lot of time with the very important points we're going to teach you, okay? My name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency, also teach medical students and medical residents. I'm also director of research. And let's get into our subject. So what is the definition of the serotonin syndrome? It's a life-threatening condition caused by excessive serotonergic activity in the nervous system, okay? You can have mental status changes, autonomic instability, and neuromuscular hyperactivity. If you miss it, patient could end up dying. Remember that. So what is the pathophysiology? There's several mechanisms, okay, not only single one. Well, let's look at some of them. There's increased levels of L-tryptophan will lead to increased levels of endogenous serotonin. Then there is increased presynaptic concentration of serotonin due to inhibition of the serotonin metabolism by MAO inhibitors. Remember that. And what happens when you take amphetamines and cocaine, MDMA, and levodopa? There is increased serotonin release there, or direct or indirect activation of the postsynaptic serotonin 1A receptors. So direct or indirect antagonism of postsynaptic 5-HT2A receptors, which enhance the effect of the 5-HT1A agonists, okay? There's always going to be like increased synaptic level of serotonin due to the inhibition of the SCRT by uptake inhibitors such as SSRI and tricyclic antidepressant, okay? Several mechanisms can cause increased levels of serotonin. So let's look into the drugs which can cause serotonin syndrome. Amphetamines and derivative, there's you got 3, 4, actually the ecstasy can cause it, dextroamphetamine, methamphetamine, sibutramine, and analgesic, you got Flexeril, fentanyl, meperidine, and tramadol. And then antidepressant, you have to be very careful. Antidepressant mood stabilizer like Buspar, lithium, MAO inhibitors like phenelcine, selective SSRI, fluoxetine, which is Prozac, serotonin norepinephrine uptake inhibitors like venlafaxine, and serotonin 2A receptor blockers, example trazodone. And then you have the St. John's wort, tricyclic antidepressant, amitriptyline, nortriptyline. Antiemetics can cause serotonin, so they're called Reglan, Zofran, and anti-migraine drugs, and Tegretol, like we use for seizure, ergot alkaloid, triptan, and valproic acid. Now, what are the signs and symptoms the patient usually present with? They can have altered mental status, they can have agitation, restlessness, confusion, anxiety, and then you have to look at the autonomic effects like hypertension, tachycardia, hyperthermia, raised body temperature is going to be tachypnea, mydriasis, dilatation of the pupil, and then you got diaphoresis, then you got shivering, vomiting, diarrhea, and you can have arrhythmia because of the increased irregular heart rate can cause because of the autonomic dysfunction, and then of course you have the neuromuscular the tremors. Clonus is another very important presentation. Hyperreflexia, then you have hypertonia. So diagnosis, mainly you have to, extensive history taking is very important. You have to get the drug history, physical examination, and exclude the other causes before you come up with a diagnosis, okay? There are two criteria very, very important, you need to know this. One is Hunter's diagnostic rule for diagnosing serotonin syndrome, and the other one is Sternberg diagnostic criteria. First, let's look at the Sternberg criteria, which you got agitation, diaphoresis, diarrhea, hyperreflexia, incoordination, confusion, hypomania, myoclonus, shivering, and required 3 out of 10 signs and symptoms. And let's look at our sensitivity and specificity is very high, 75% sensitivity and 96% specificity. So we did the positive likelihood ratio. Okay, very, very important, some statistical tests. So positive likelihood ratio is like 18.75. That means almost like 60 to 70% increase in odds. So Sternberg's criteria is a very good test to diagnose serotonin syndrome. Now let's look at the Hender's decision rule, right? First you look at the spontaneous clause. Then you look at the inducible clonus with agitation or diaphoresis, ocular clonus with agitation or diaphoresis, tremor and hyperreflexia, hypertonia, temperature above 100.4. And if you don't have any of those, you can say no serotonin toxicity. Let's look at the sensitivity and specificity of Hunter's decision rule. Again, pretty high, 84%, 97%. Look at the positive likelihood ratio. Okay, LR ratio is 28. So it's extremely important. So you need to, to diagnose, use this criteria. So likelihood ratio is like 28. That means almost like 90 to 100% chance of having your diagnosis right, okay? So those are the two criteria we can use. So how do you treat the patient? First, always can involve withdrawing the agent causing it. Always focus on that first, okay? And then you provide supportive care. Benzodiazepine, and they can, cryptoheptadine is a serotonin 2A antagonist is usually recommended. Initial dose like 12 milligram, and then you can follow by additional 2 milligram. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. Thank you.